Why neutered and spayed cats live longer. Pet owners and doctors have been interested in the link between spaying or neutering cats and how long they live for a long time. A lot of people think that cats and dogs that have been neutered or spayed tend to live longer and better lives. The point of this article is to look at the statistics that back up the claim that spayed female cats live 39% longer than unspayed female cats, and neutered male cats live 62% longer than unneutered male cats. These numbers should be taken with a grain of salt and looked at along with other things that affect animal health, but they do show that spaying and neutering our cats might be good for their health. What spaying and neutering do for pets? By surgery, the reproductive parts of cats are taken out during spaying and neutering. When a female cat is spayed, her eggs and uterus are taken out. When a male cat is neutered, his testicles are taken out. People often do these procedures on cats for a number of reasons, such as keeping the cat population in check, lowering bad behavior, and maybe even making the cats healthier and longer lived. Statistical proof. The act of spaying or neutering cats is linked to their living longer, according to statistics. The American Veterinary Medical Association, AVMA, did a study that found neutered males tend to live about 62% longer than unneutered males, and spayed females tend to live about 39% longer than unspayed females. These numbers are definitely important and should be thought about. What it does to health. Some health problems may be less likely to happen after an animal is spayed or neutered, which is one of the main reasons for this rise in longevity. One example is that spaying female cats can greatly lower their chance of getting uterine infections and mammary tumors, which are often cancerous in cats. Males who are neutered are less likely to get testicular cancer and are less likely to act in bad ways, like wandering and being aggressive, that put them at greater risk. Another important factor is how these treatments change behavior, especially in men. Neutering cats can make them less territorial and violent, which means they are less likely to fight, which can hurt others and spread diseases. Males who have been neutered may live longer and be healthier if they change their behavior in this way, limiting the population. Spaying and neutering also helps reduce the number of animals in the area. Getting rid of unwanted kittens and cats in these ways helps with the problem of overcrowding, which often causes animal shelters to have high euthanasia rates. When people don't want cats, there are fewer homeless, neglected, and possibly abused animals, which improves the cat's quality of life generally. Things to think about and warnings. Even though the numbers are strong, it's important to think about other factors that could affect a cat's lifespan. A cat's longevity depends on its genes, its diet, its access to health care, its living conditions, and its general way of life. The timing of the operation can also change the outcome of spaying or neutering. Spaying and neutering pets as soon as possible is usually a good idea, but the effects can be different depending on how old the pets are when the procedures are done. Finally, the numbers that say spayed female cats live 39% longer than unspayed female cats and neutered male cats live 62% longer than unneutered male cats should not be taken as absolute truths. But they do tell us important things about how these treatments might help cats' health and length of life. Not only do spaying and neutering lower the risk of some health problems, but they also help keep the number of cats in check, which is good for the general health of these beloved pets. Many people find these figures very convincing, but they should not be the only thing we think about when we make decisions about our cat's health and well-being. When should I get my cat spayed or neutered? How old a cat should be to get spayed or neutered depends on its breed, size, and general health, among other things. However, many vets and animal care groups say that cats should be spayed or neutered at a certain age, usually when they are 5 to 6 months old. Here are some things to think about and rules to follow. 1. Early spaying or neutering. Some vets and shelters encourage early spaying or neutering, which can happen on cats as young as 8 weeks old and as heavy as 2 pounds. It is becoming more normal to spay or neuter cats and dogs young. This is usually thought to be safe. It can help stop unintended pregnancies and may also have some positive effects on behavior. Your breed and size. Larger breeds may take longer to grow, so you might want to wait until they are closer to 6 months old. Your vet can give you advice based on the type and size of your cat. 3. Health and weight. Before the surgery, you should make sure that your cat is healthy and the right weight. To handle the anesthesia and operations better, kittens should be healthy and well-fed. For behavioral considerations, spaying or neutering a male cat when it is young can help stop bad habits like spraying and being mean. If you spay a female cat before her first heat cycle, she may not do things like yowl when she wants to mate. 5. To stop cats from leaving behind unwanted litter, it's important to spay or neuter them before they can breed, which usually happens before they reach sexual maturity. 6. Talk to your veterinarian. Talking to your vet is the best thing to do. They will be able to figure out what your cat needs and make specific suggestions based on its age, health, and situation. 7. Local laws and regulations. Know what the local rules are about spaying and neutering your pet. Some places may have special rules or rewards for careful pet owners. Remember that getting your cat spayed or neutered is important for its health and well-being in the long run, as well as to stop unwanted litters. These steps can help lower your cat's risk of some health problems and make it a happy, better-behaved pet. It is always best to listen to what your vet says and make the choice that is best for your cat. Will getting my cat neutered hurt it in any way? Neutering, the surgery to remove a male cat's testicles, is a regular and usually safe procedure that is done all the time in veterinary care. Neutering cats is often suggested for a number of reasons, such as reducing the number of cats in the area, dealing with behavior problems, and improving the cat's health and well-being as a whole. Even though neutering is usually safe and good for cats, there are some risks and things to think about. 1. Anesthesia. Neutering needs anesthesia just like any other surgery needs it. There is always a small chance of something bad happening with anesthesia, but current veterinary techniques and tools have made these chances much smaller. Before the process, your vet will check your cat's health to make sure they are healthy enough to be put to sleep. 2. Infection. It is possible for an infection to happen at the site of surgery, but it doesn't happen very often. Your vet will take steps to lower the risk of infection, but you can help by keeping the area where the surgery was done clean and watching for any signs of infection in your cat after the surgery. Weight gain. Cats that have been neutered may gain weight more easily, which can become fat if not controlled. To keep this from happening, make changes to your cat's food and exercise routine based on what your vet tells you. 4. Changes in behavior. Neutering can cause good changes in behavior, like less spraying to mark territory and less aggression. But some cat owners might be afraid that it will change their cat's attitude. Any changes in behavior are usually for the better and are seen as positive. 5. Long-term health benefits. Neutering can lower the risk of some health problems like testicular cancer and problems with the prostate. It can also lower the risk of injuries from fighting over territory and moving around looking for a mate. Time. The affects of neutering can be changed by the age at which it is done. One example is that neutering a cat when it is younger might have a bigger effect on its behavior than neutering it when it is older. It's important to talk to your vet about the process and any worries you have. They can give you information that is specific to your cat's needs and situation. Neutering is a popular and usually safe procedure. The benefits in terms of controlling populations, behavior, and long-term health often outweigh the possible risks. The treatment is a responsible choice for cat owners who want to make sure their cats are healthy and happy. How long does it take for my cat to fully heal after being spayed or neutered? There are no set rules for how long a cat needs to heal after neutering surgery, but here are some general things to keep in mind. Before you start getting better, here's what you can expect. The time right after surgery, 1 to 2 days. Your cat may still be asleep right after the surgery because of the drugs. They might feel sleepy, lost, and shaky on their feet at this point. It's important to give your cat a safe, warm, and quiet place to rest. Make sure you follow your vet's advice about what to feed and give your pet after surgery. 2. Care for the cut site. You will need to keep an eye on the cut site to make sure it stays clean and doesn't get infected. Some cats may have skin glue or stitches that dissolve on their own, so they don't need to be taken out. If stitches are used, you may need to make another appointment with your vet to have them taken out. 3. Activity restriction, 7-10 days. To avoid problems and make sure a quick recovery, your cat should stay quiet and not jump or do other hard activities during the first few days of recovery. If you don't want your cat to lick or chew on the wound, put on an Elizabethan collar with a cone on it. 4. Returning to normal activities. Your cat should be able to start doing normal things again after about a week. but it's best to slowly start doing exercise and playing again to avoid getting hurt or stressed. Watch the area where the cut was made for any signs of redness, swelling, fluid, or anything else that doesn't seem right. 5. Follow-up visit. Many vets suggest that you take your pet back for a follow-up visit a week or two after surgery to make sure the wound is healing properly and there are no problems. 6. Changes in behavior. Cats that have been neutered may show changes in behavior over time, such as becoming less aggressive and marking their territory less. It might take a few weeks to notice these changes. It's important to follow your vet's exact instructions after surgery, since they can be different depending on your cat's health and the type of surgery that was done. During the healing process, you should always keep an eye on your cat. If you are worried or see signs of infection or other problems, you should call your vet. Different cats heal at different rates, but most should be back to normal within 2 weeks of surgery. But it's very important to make sure you get the care and attention you need right after surgery to make sure you have a smooth recovery.